Do that one dance, baby. That one dance.
Hi everyone, we are Methyltestosterone.
Our generic name is methyltestosterone. Our brand names are Argoviron, Android, Metandrin, Oraviron, Oriton, Testovis, Testrid, and Virilin.
My chemical name is 17-beta-hydroxyl 17-alpha methylandros 4-en31 or for short.
For our drug classifications, we fall under androgen and anabolic steroids.
Pregnancy category X. Studies in animals or humans have demonstrated fetal abnormalities, and there is a positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience, and the risk involved in the use of the drug in a pregnant woman clearly outweighs potential benefits. Methyltestosterone, mimicking testosterone, binds the systolic androgen receptors on the subsequent nuclear transfer of ligand receptor complex, induces transcription initiation of androgen-responsive genes. The gene products are responsible for normal growth and development of male sex organs and secondary sex characteristics. The agent also causes retention of nitrogen, sodium, potassium, phosphorus, as well as calcium.
Now, let's talk about our pharmacokinetics. We are a testosterone derivative bearing in a methyl group at the 17th alpha position. We increase bioavailability that results in steric hindrance and prevent metabolism. Our oral bioavailability is about 70%, and it is well absorbed from the gastrointestinal tract. We can be administered via sublingual, buccal, or oral route. However, we are more effective when taken orally, in which we can double our bioavailability. We are 98% protein-bounded and has a low but significant affinity for human serum sex hormone binding globally. Our half-life is approximately 3 hours. The duration of our action is 1 to 3 days and is described as relatively short among the AAS. 90% of us is excreted in the urine as conjugates and other metabolites, while 6% is excreted in the feces.
Methyltestosterone is an anabolic steroid hormone used to treat men with testosterone deficiency. It is also used in women to treat breast cancer, breast pain, swelling due to pregnancy, and this with the addition of estrogen, it can treat symptoms of menopause.
Yes, we are useful. However, our presence might harm your body if not taken into consideration. That is why, to avoid further complications, you must take note of these contraindications. First, use us with caution in women and children. This is because we can cause irreversible volatilization. Second, due to our estrogenicity, we can also accelerate epiphyseal closure and hereby produce short stature in children and adolescents. Third, we can worsen symptoms in men with benign prostatic hyperphagia. Fourth, we should not be used in men with prostate cancer. This is because we can accelerate tumor progression. And lastly, we should be used with caution in patients with pre-existing hepatotoxicity.
Side and adverse effects categorized by body system in endocrine and urogenital. For female, the most common side effects of androgen therapy are amenorrhea and other menstrual irregularities, inhibition of gonadotropin secretion and virilization, including deepening of the voice and clitoral enlargement. The latter usually is not reversible after androgens are discontinued. When administered to a pregnant woman, androgen cause virilization of the external genitalia of a female fetus. For male gynecomastia, an excessive frequency and duration of penile erection, oligospermia, may also occur at high dosage.
For the skin and appendages, we can cause hirsutism, male pattern of baldness, and acne.
For cardiovascular disorders, myocardial infarction, and stroke.
In fluid and electrolyte disturbances, we can cause retention of sodium, chloride, water, potassium, calcium, and inorganic phosphates.
For gastrointestinal, nausea, cholestatic jaundice, alteration in liver functions tests, rarely hepatocellular neoplasm, and ileosis hepatitis.
For hematologic, I can cause suppression of clotting factor 2, 5, 7, and 10. I can also cause bleeding in patients on concomitant anticoagulant therapy and polycythemia.
For nervous system, increased or decreased libido, headache, anxiety, depression, and generalized paresthesia.
For metabolic, I can increase serum cholesterol.
Vascular disorders, venous thromboembolism. Nursing responsibilities before, during, and after, assuming we had executed the nursing process. Now, before administering drugs, ensure the following rights: right patient, right medication, right reason, right dose, right route, right frequency, and right time. Nursing diagnosis and medical diagnosis. These determines the drug therapy that is appropriate and relevant to the nursing and medical diagnosis. After diagnosis, you can choose the best therapy you can administer. In implementation, nurse should monitor the client or patient of any adverse effect of the drug. It is the nurse's responsibility to check the route, dose, preparation, timing, and recording of the data. There will be adverse effects of the drugs, and it is the nurse's responsibility to help the client prepare or cope from it. Patient and family education. Be prepared for distressing and undesirable adverse effects of virilization in women, since dosage sufficient to produce remission in breast cancer is quantitatively similar to that use of androgen replacement in the male. Report sign of virilism promptly. Voice change and hirsutism may be irreversible even after drug is withdrawn. Report priapism for men or other signs of excess sexual stimulation. The physician will terminate the therapy. Report symptoms of jaundice with or without pruritus to physician. Appear to be dose-related. If liver function tests are altered, at the same time this drug will be withdrawn. Do not breastfeed while taking this drug. Assuming we've completed the nursing process, first thing you should never forget is documentation. Documenting data is essential to avoid any errors. In case of errors, the documentation will help the healthcare provider to make an intervention. After documentation and after one dose or the drug therapy, evaluate the client if the goals and objectives are met. Educate the client on things to do and avoid after therapy. In any case, essential for maintenance of health and prevention of sickness.
That's it, guys. Thank you so much for watching.